Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I was asked to do a video on documentation that the Transit Workers TWU Local 100 keeps putting out, comparing their Medicare Advantage plan to the city plan that was offered to city retirees. And I keep saying, I don't want to do a video like that because I'm arguing that Medicare Advantage is not a good plan. And it might be good for some people, but it's not good for everyone. I would prefer you compare Medicare Advantage to traditional Medicare, right? I get, again, another bunch of requests. So I'm going to show you, you've already heard me a million times over the last 2 years, explain the differences between traditional Medicare and Medicare Advantage. Now, I want to also show you some of the lies that union leaderships, some will go to try to convince you that the plan that they're trying to jam down your throat is better than someone else's crappy Medicare Advantage plan. And then I'll also put in my 2 cents about traditional Medicare. So let's go to that document that was shared by Transit Workers Local 100. This is where they're trying to tell you, hey, don't worry about that CPPO plan that we got rid of. It's okay that we got rid of it because look what we got for you. What was old in the old CPPO plan, I don't really know what the hell they're talking about was what was old, because what they're saying is the CPPO plan, which is the supplemental or Medigap to traditional Medicare, that is the healthcare plan that you should want. Why? Because, like you've heard me say a million times, there's no networks, there's no prior authorizations unless it's for like something really big like a transplant. 97% of doctors in America take this plan. And no Medicare Advantage plan can say that, not even Aetna. So here is where they're starting to compare some of the plan design for CPPO and the new enhanced option 1 and the enhanced option 2, and option 1, option 2 of your Medicare Advantage plans. So there are definitely some differences between those plans, between the CPPO that you were offered through traditional Medicare and your Medicare Advantage plan. So, as well as for city retirees, right? So, New York City retirees here, for first example, eligible medical providers in the CPPO, there's well over 1 million providers. Yes, that is a fact. However, there's about 1 million providers, according to the American AMA, American Medical Association. There are just about, or just under 1 million providers in America. Aetna Medicare Advantage can't say that. This is just a pure lie. They count, when you ask Aetna how many doctors, how many medical providers can you are covered under your plan, you want to know like how many belly buttons, like how many individual doctors. Because let me tell you what insurance companies do. If I am a gastroenterologist and I'm an internist, many insurers count me as 2. Internist, gastroenterologist. If I have 2 offices, if I have an office in Queens and an office in Manhattan, guess what? I'm now 4. And that's not true. So understand something. This is a play on words. No Medicare Advantage plan I am aware of that has over 1 million providers. Also, what they're trying to allude to the fact is that any doctor that accepts Medicare can accept their plan. Well, the key is that they don't. And that's what you need to know, because this is another play on words. I would say, show me your directory. And so far, even Aetna, when we called them last week, cannot give you a directory. The Part B reimbursement on your CPPO plan versus your option 1, option 2, you are getting a little bit of money back. And on the option 2, you're getting the full basic premium for Medicare back. New York City retirees, we get the full premium back every year. So 0 copays, the emergency room. So all of that is your CPPO. Now, where they talk about vision, hearing aids, silver sneakers, dental, we as city retirees, we don't need that, because we get that from our union welfare funds, you know, that other plan that we earn from being in our union forever. And you don't need that in Medicare, because what those things are there for is because you're being given those perks because they're taking away something else from you. They're taking away your direct access to providers and hospitals, networks across the country, network provider networks, like MSK or HSS. They're all of their satellite offices. You can't just, like in some of the plans, you can just see one location. You can't see all of them. That's wrong. Traditional Medicare, 97% of the doctors in America accept Medicare, and the 3% that don't are typically psychiatrists and pediatricians, something most of us don't need. So that's basically explains, page 1. The drug issue also, so I'll get to that on the next page, but you have different benefits for your CPPO versus your option 1 and option 2. So now TWU wants to try to compare your plans, your Medicare Advantage plans, to our plan. And it says both of your options are less expensive across the board. But remember, this isn't just about the design of co-pays and whatever. It's about your access. And so, the plan that was created for us only because of our complaining and our litigation over 2 years required that the city suspend most of the prior authorizations that are in the plan, but they didn't suspend them all, and not the most critical ones that we need as seniors: hospitalization, rehab, skilled nursing. Those are still subject to prior authorization. That's egregious because you don't have that in traditional Medicare, which was on your CPPO plan. So this is still a problem because your plan is the same as our plan. And the contract that you're in is called H5522, which is exactly the same contract that the city retirees are in. So every time I hear Mr. Donahue or Mr. Richard Davis talk about how your plan is better, it's the same plan. So this just drives me crazy. They also say that we have $15 copays on primary care visits and specialists. That's a lie. Only on specialists, not on primary care physicians. The rest of that is basically accurate. Also, annual maximum out-of-pocket. While we do have a $1,500 maximum out-of-pocket, you have a 0 on plan 1 and $1,000 on plan 2. This is why your CPPO is important, because Medicare pays your first 80%. Your supplement or Medigap pays that last 20%. There were no copays. If you had a small deductible on the CPPO, as we did, it was $50. Once you've met that, there were no costs to you. You didn't need to worry about an annual maximum out-of-pocket because there were no out-of-pockets. Our senior care plan, because we have 14 choices of plans as a retiree in the city of New York. Our senior care plan, which is about, 84% of retirees are on, very similar to your CPPO plan, which is also your traditional Medicare option, same situation. So that's why it's important to know the difference. The other misinformation here is the drug plan. So many of us have a union welfare fund drug plan. Most of us do not pay a premium for it. There are some workers like managerial titles and the teachers that do pay a premium. And I'll get to that as well. So our plans are mostly different. Every union has its own welfare fund, which is probably one problem where the city unions could be saving money if they did actually consolidate that. Their leverage would be huge. But every union's welfare fund is different. Most of their union retirees do not pay for that. Also, it says 0 for some generics at CVS. No, actually, in most of our plans, you can, while there are some copays on some of them, they're typically small. We get 3. We can do a 90-day prescription. You'd only pay 2 copays for 90 days and 3 months worth of drugs. So you get 3 months worth of medicine for 2 copays. And you can use any network. It also operates kind of like a Medicare Advantage plan. You could use any program, any pharmacy in the network. So that's that. Now, this is another blatant lie that your union, TWU Local 100, is putting out about their city plan. And they're playing on the fact that you don't know the facts. So I'm here to tell you them about the city's other plan. So I already said to you, the city has 14 choices of plans. There's only about out of 183,000 retirees Medicare eligible, only about 11,000 of them are on the HIP plan, which they mention here. not the 100,000 something people that are on the GHI senior care plan, which is the equivalent of your CPPO plan. So they write, there's been little discussion of the city's other Medicare plan, and here's why. The other plan is a Medicare HMO offered by HIP. So wonderful that you guys think you know what you're talking about, TWU, Mr. Davis. I mean, this is absolutely egregious because we have 14 choices of plans, and the largest number of retirees are in the GHI senior care plan, which is not an HMO. It is the supplement to traditional Medicare, like your CPPO plan. You can go to any doctor in America that accepts Medicare. So this plan, it says you can only use HIP's in-network Medicare providers in New York City and 5 suburban counties. So it's 8 counties of New York that you can, the lower counties. Yes, that is true. It is an HMO plan, but there's only 11,000 people in that plan, and that's not the majority. They're happy. They live in the city. They live in those boroughs. They live in those counties. It works for them. That's the key. Hear what I said? It works for them. The senior care plan is a completely different story. It doesn't have a network. It's not an HMO. It doesn't need to be an HMO because it's a supplement to Medicare. If the doctor accepts Medicare, they must accept the supplement. It says you can't go to a specialist without a referral from your primary doctor. In the HIP plan, not the Medicare supplement GHI senior care plan. In the senior care plan, there are no referrals. You don't need a referral to your doctor. There are no networks, none of that. The doctor takes Medicare, you go. In this HIP HMO plan, it is an HMO, Medicare Advantage plan. So you're comparing, like, I don't know, apples and I have no clue what to say. Something that doesn't even make any sense. Like, I don't know, shoes. You're not comparing the same things. To continue, you talk about the different cost insurances, Medicare Part D plan, prescription annual premium. That again is not correct because that is only if they're purchasing the city drug plan that they don't have a union plan. Most of our drug plans are free. So if I was in HIP VIP, my drug plan is free. I am in a union that does not charge me a premium for a drug plan. You then write, we do not have an HMO. We have 2 nationwide Medicare PPO options. And we have 1 nationwide Medicare PPO nationwide option, but it is the same plan as yours. While they say it's accepted nationwide, if you read the contract and you read the EOC, they absolutely admit that there are counties in half of your states that have absolutely no coverage in your Medicare Advantage plan. You need to read the contract. As I said, your contract, H5522, is exactly ours. So enough on that because I think I made my point. That is a pure, blatant lie. They're comparing something that shouldn't be compared to. Then they said that they wanted to compare how do your 2 plans stack up against the city's new Medicare Advantage plan. Again, like I'm banging my head against a wall. I don't need to be comparing garbage to garbage. You should be comparing garbage to the traditional federal public health benefit of Medicare. So you say that both your options are less expensive across the board. I think this was one of the first slides. Yes, it was. Okay, so we'll skip this. Yep. That's where I highlighted all the lies on this page. Your transit workers, enhanced retiree benefit coverage. So remember, the only enhancement to your plan is that they gave you perks. You don't need perks. You're basically giving away access to doctors and hospitals in America. I actually can prove all of this to you. There's no reason to have a perk. When they give you rides, you can get Access-a-Ride today. If you need meals, you're a senior, you're disabled, you've got Meals on Wheels. You have access to everything that you need. You shouldn't be selling off your health care for this. It would be like if I sold you a car and I didn't give you the tires, but I gave you a pair of sneakers. And you go, why do I need the sneakers? Well, you're going to need the sneakers to walk to your doctor's visit because the car's not going to get you there. You're purchasing insurance to get you to the doctor, to get you the health care that you need. If I'm giving you all these other perks and bells and whistles and sparkly things so that I don't have to pay for the healthcare that you need, that's a perk, but it's not a benefit. And this is exactly what I'm trying to tell you. I don't need vision benefits. I get that from my union. I don't need hearing aid benefits. I get that from my union. I don't need teledoc. Teledoc's already in Medicare. I don't need transportation meals. You can get that from Meals on Wheels and Access-a-Ride. These are things to detract from you. Oh, let me go get that. No, you don't need that. You need insurance. Stop trying to sell off your health insurance for something else. So the next document I do want to share with you. This document is the New York City Aetna Medicare Advantage PPO plan that was supposed to go into effect that the court stopped. And it is basically the same as your plan. This does show you that we do have an out-of-pocket of $1,500, but again, in traditional Medicare, you don't need an out-of-pocket because there are no costs. Primary care physician visit, $0. Like I said, your union lied about that. Specialist visits are $15. Diagnostics are $15. The hospital pays, and this is where they were also disingenuous. They also said that those copays were, that coinsurance, your copays, whatever, were $300 a stay and $750 maximum. In this document, it shows you that in 2023, the year that the plan was supposed to start, they would have been $0. In 24, they did increase, excuse me. Also, the drug plan. One of the things that other flyers showed was that the drug plan cost was $1,242 a year, which says that the drug plan cost was $103 a month, and that was for 2023. For 2024, those go up to $135 a month, just so you do know. Here they talk about the employer PDP, that Silver Script drug plan, annual prescription drug plan, deductible is $0. Tier 1 generic drugs, 0% network retail pharmacy. So you're not paying a copay if you stay in their network. And they have a network. There's a book that Aetna puts out because, like I said to you, we already have this plan, and many of the unions also have this plan for their own welfare funds. So your deductible is $0, and your generic drugs, and this says it's the cost of tier 1 preferred generics in the initial coverage phase. Different cost shares apply to different tiers, generic, brand, and coverage gaps. And again, this plan is different from the welfare fund plans because many of them also have that, but have different benefits within that plan. So again, the spotlight that you do need to know is that these plans, our document in these plans, our brochure specifically says right here, if you are currently undergoing treatment at Memorial Sloan Kettering and Hospital for Special Surgery, you will continue to have access to both MSK and HSS. Both providers are in the Aetna Medicare Advantage PPO network. We called the network. We called Aetna. We called the hospitals about the New York City Transit Plan. They could not say that. They cannot say that. And while they are paying for some of your services, they're paying for them on an out-of-network, and there's a co-insurance to the retiree. Again, they kind of lie about the participating providers in the network. And that is because, again, they're not counting belly buttons. They're just counting like I told you that they were. So there's a lot of misinformation here. You shouldn't be comparing two Medicare Advantage plans. You should be comparing Medicare Advantage to traditional Medicare. That's what you should be comparing to. And remember something as well. Aetna also took a hit on its star rating, which is typically generated by consumer preference, if they liked it, on how they liked their plans during the year. When that plan took a 1-star hit, that cost Aetna about $3.4 billion, okay? And then that's when they moved us out of H5521 into H5522, which is a plan that's based out of, I think, Pennsylvania. And there's only about, like, I don't know, 22,000 or 22 million subscribers. That's the plan they just moved you into. So it is the same plan. They moved you into a plan that not millions of people are in. It's a small plan based in another state that had a preferential scoring by those that were in it to get you out of the 3.5 the 3.5-star plan and put you in the 4-star plan. That's really all they did. Star rating is based on how consumers said that they liked their plan. But we all know when you leave the car dealer, they say, hey, if you liked our service, give us 5 stars. That's kind of like how they did that in these. And so, and you need to look at not just how many of those surveys they put out, you need to also look at how many people replied, because that's another indicator. Sometimes people will go like, oh my God, they were so horrible, I'm not even answering this, I'm putting it in the garbage. I mean, that's kind of a mistake in itself, but that should be also an indicator. One of the things that Medicare recognizes is that they need to change the indicators for more based upon how the plan outcomes were rather than opinion. Because that's not how they should be subsidized. The higher the star rating, the more money that Aetna gets. Now, if Medicare chooses, which they probably will, modify how much money that they give these private insurers to administer Medicare for you, thereby privatizing it, and that Medicare provides Aetna with less money during the year, then they're going to come back to the MTA and they're going to say, hey, listen, the cost of running this plan costs us more money, you're going to have to pay. And if the MTA does not, then they're going to pass that premium cost on to you. Right now, it is premium free, and you would be then in this honeymoon period. But see, this is all dependent upon federal tax dollars, which of course you pay. This is why Medicare Advantage plans cost the taxpayer, the American taxpayer, more money, because you are subsidizing a for-profit company. So we keep trying to tell you this. This keeps happening around the country. Everyone keeps saying, well, 51% of people in America are now choosing Medicare Advantage plans. No, that's not true. Yes, a lot of people are choosing them because of their malicious sales tactics. But then there's situations like ours where they're going around the country convincing union leaderships and former employers to auto-enroll their seniors into them. And that's egregious. That is trying to capture market-based, forcing them into a plan that they wouldn't have otherwise chosen on their own. So that's that for this little video. Have a great day. Do not believe everything that you're told. Fact check it. Look at it. Pull up the city documents. Pull up the TWU documents and compare them. This is not real. They're trying to compare their plan with the plan that most retirees are not in, although some choose. They need to be comparing that Medicare Advantage plan and your CPPO to the Medicare Advantage plan offered to the city retirees and the city senior care plan, which is the equivalent to your CPPO. And remember, you can't get any better healthcare than you can with traditional Medicare with a supplement. Have a great day.